Welcome back to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms in downtown Detroit. Dr. Kolender is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, Dr. Kolender, last segment you talked to us about how in your internal medicine practice you segued over to a more private practice with more time with each patient. And you also talked about how you yourself turned your own life and your own health around. Can we pick up where you left off talking about heart attack and where we're at with that right now?
Absolutely, Anne-Marie. I was so excited to learn that all these diseases that I thought were fixed, and frankly, everyone thinks they're stuck in whatever genetic mode they're in, and my dad did this, and so I'm gonna live to 90, or my dad died at 50, and I'm gonna have a heart attack at 50. Everyone feels that way, and to learn that that's not the case was really exciting to me, and I wanted to bring all of this into my practice. And I continue to look for ways to learn about how to keep people alive, and I've learned since then that heart attack and stroke are 100% preventable. And
Well, why do we have so many people dropping dead of heart disease then, if they're preventable?
well, the system that we're in is failing. And the system that we're in wants to provide a formula that fits everybody into a formula and treat them based on the same formula. And unfortunately, that just doesn't work. We already know that because you just said people are dropping dead. You hear about a celebrity dropping dead, every week. And these are people who have access to every kind of health care.
Right.
So if someone with supreme access to health care is dying, the system is not working. So what is the problem is that we're not understanding the real process of disease. So what I want everyone to understand is that heart attacks and strokes are not caused by blockages. This is the generic term that we've all been brought up on. What's your blockage? What's your stenosis? How much blockage do you have? And that and what's your cholesterol are like the numbers to life. And it's really not the answer anymore. It's not a question of blockages, because blockages don't cause heart attack and strokes. What causes heart attack and strokes are blood clots. And this is kind of a shock because everyone only knows the term blockages. The only thing that blockages cause are stents and bypasses. When you have a blockage that gets to a high degree of constricting your blood flow, then you have symptoms of shortness of breath or dizziness or fatigue or chest pain. You go to your cardiologist, they do a stress test, and you fail it, and then you end up having that area of blockage fixed. People don't die from a heart attack from that process. They don't have a stroke from a blockage that gets to that degree. People have a heart attack and stroke because an artery that is inflamed at 30% ruptured and formed a clot. Your body forms a clot to heal a rupture within the wall of your artery. And you go from 30% to 100% in 5 minutes. And that's how you go from...
Well, that's pretty dramatic.
It's scary. That's how you go from, I'm doing great to I'm dead. Most people present with, heart disease. Their first presentation of heart disease is death.
That's right.
With a toe tag. So we need to start identifying people earlier. And, so here's some of the misnomers that you may want to think about. A stress test. So we just talked about stress tests. What does a stress test tell us? A stress test is a supply-demand issue. You take a picture of your heart at rest when you're not requiring more oxygen to your heart. When you're on the treadmill, your heart beats faster and it needs more oxygen. If there's a 70% or greater blockage, now that blood flow to the heart is restricted during your exercise portion, and the picture comes out abnormal. But of course, that's going to happen because you're having symptoms. Some people don't have symptoms and they're just getting a random stress test. and they get picked up. And this is happening because there's so much disease out there that people are getting picked up on random stress tests with a blockage greater than 70%.
Okay, wait, can I just ask a question?
Yes.
Here's the question. So many people go for their annual physical, and there are so many people who have a history of heart disease in their family. And you hear them saying, I'm okay because I had an EKG and it was fine, and or they had a stress test and it was fine and I passed. And then maybe some of them may wind up going on for cardiac calcium scoring test or, something like that. And then they find, oh, they're not fine. So why is it missed on these basic tests that you are clearing people and not doing further tests? That's what I want to know.
The reason for that, Anne-Marie, is that most of these tests, if not all of them, are blood flow tests. They're looking at blood flow, and so is the stress test. So if you have a blockage, I keep using the word blockage, but we need to get away from that. If there's plaque that is less than 70% blocking your blood flow, you're gonna pass your stress test. And what is surprising is gonna shock you and everybody listening right now is that most of the people, 85% of the people that have a heart attack or stroke have a blockage below 50%. So they had a plaque that's inflamed, and we're going to keep talking about inflammation. This inflamed plaque ruptures and your body forms a clot, and that clot will block your artery and cause you to die or have a stroke. The stress test is measuring flow. Your carotid Doppler is measuring flow. Your CTA, which is your CT arteriogram of your heart arteries, is measuring flow. How many people out there listening right now have been told they have mild heart disease because they only had a 20%, 25%, or 30% quote unquote blockage? You're okay for right now. If you're listening to this and you're hearing what I'm saying, you should not be feeling okay, because 50% of people who have a heart attack or stroke have a 30% blockage that, I keep saying the word blockage and I need to stop, a 30% plaque that ruptured and caused them to die. So there is no such thing as mild heart disease. We're looking for the wrong thing. We're looking at flow. We need to be looking at inflammation. Again, there's enough disease out there for the cardiologists to identify people at 70% or greater and keep them busy. But if you want to prevent getting to that point, you need to identify your inflammation. And the way to do this needs to be done in a personalized way. There is no formula. There's no way in the current health system to identify your risk and treat you in an optimal manner to make your risk of heart disease drop to zero. And we said it last segment, I'm gonna say it again, it's 100% preventable. Having a heart attack or stroke is a disease that is preventable 100%. It requires a complicated look at all your areas that pertain to you, things that don't matter to someone else or matter to you, something that matters to you may not be important to somebody else. But we've got to take a comprehensive look, and this is another reason why I became a concierge doctor. Is it takes a lot of time. I need a lot of time with everybody. I know I spent an hour and a half with a patient earlier this week, and we ran out of time. I needed another half hour with this person.
An hour and a half at one shot. One
it was not enough.
And you
not enough time. And there's a lot to go through to get to the point where I can say we're going to keep you healthy. And we need that time. And I want everyone to know out there, it's available. Call me, call a practice like me.
And get into concierge
right.
care. Okay, well, we're going to have to take a quick break. In the meantime, you're listening to the Kolender Medical Show. You can call Dr. Brian Kolender by reaching him at 248-737-0091. Again, that number is 248-737-0091. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR.